Coalition represents patients, taxpayers, labor, health policy groups, and community advocates. Let's see who's with us today. Albany Park Neighborhood Council. Chicago Coalition for the Homeless. Lakeview Action Coalition. Logan Square Neighborhood Association. Health and Medicine Policy Research. SEIU-HC. Local 73 Doctors Council. Action Now. Partisans for the Common Good. Illinois Coalition for the Immigrant and Refugee Rights.
Good morning, everybody. Good morning. My name is Curtis Smith. That's spelled C-U-R-T-I-S-S-M-I-T-H. I'm a board member of the Lakeview Action Coalition, which is a proud member of the Fair Care Coalition. We are here today because we hear stories every day from patients who are uninsured and underinsured that are being shackled by debt from their local nonprofit hospitals. We know that our government gives nonprofit hospitals significant tax breaks with the understanding that they will use that money to provide free care back into their communities. Right. But instead of providing charity care, some wealthy hospitals have used these tax breaks to enhance their profits, while many uninsured patients remain saddled with hospital debt. We are here today because today is March 1st, and this is the deadline Governor Quinn set for negotiated legislation determining how much charity care hospitals have to provide in exchange for their tax breaks. More. But no solution has been created. The Illinois Hospital Association is promoting a status quo proposal that does not help our communities. We are outside the Ritz-Carlton because hospital trustees are at a fancy breakfast inside speaking about how not-for-profit hospitals can maintain their tax exemption status, rather than identifying on how they can fulfill their charitable missions in the way that serves the most vulnerable members of our communities. We are calling on Governor Quinn to continue to stand with consumers and taxpayers and direct the Illinois Department of Revenue to resume denying property tax exemptions for rich hospitals that do not do their fair share of charity care until a real negotiated solution is on the table.
I'd like to also introduce CeeLo, who will give us a little background on what her issue is on.
All right. Good morning, everyone.
Good morning.
My name is CeeLo Lewis, and I'm with the Chicago Coalition for the Homeless, a member of the Fair Care Coalition. Despite negotiation between the Illinois Hospital Association and stakeholders, the governor's deadline passed with no solution. We know the status quo solution, which the rich non-profit hospitals have proposed, is really just business as usual. That means while negotiations stall in Springfield, patients continue to be shackled with enormous medical debt, or they are simply dumped to the overburdened public system.
That's not fair.
Medical bankruptcy can lead to homelessness. We hear these stories every day. We would now like to introduce a few people who will tell us firsthand how this crisis has affected their lives. Thank you.
My name is Juan Jimenez, and I am a leader of the Albany Park Neighborhood Council. I do not have health insurance. Last year, I went to the emergency room of my local hospital 3 times. The first time was because I got into a car accident, and another 2 had to do with severe stomach pain due to gastritis. During these 3 visits, the hospital never explained charity care in a way that I would understand my responsibilities so I can receive charity care.
Good morning, everyone. My name is Dr. Sonia Lott. I work for Cook County Hospital and Health Care System. I am also a member of Doctors Council, SEIU Local 73. As a physician serving patients in the Cook County Health and Hospital System for over 13 years, it has become evident that many of the patients we treat in our system have come from other hospitals who would not provide these patients basic health care needs because they were uninsured or underinsured. I have had patients tell me that they stopped seeking medical care because of the mounting medical debt they faced from these institutions, and that some didn't even know about the Cook County Health and Hospital System and other safety net hospitals in the area that provide this charity care until they were turned away from these hospitals and told to come to us.
That's awful.
As a healthcare provider and patient advocate, I feel that charitable care must be provided to all patients who are uninsured and underinsured, and that the burden cannot be met by these few safety net hospitals in our area alone.